Imagine being actually afraid to shake someone's hand. Not because you're nervous or shy, but because your hand is just constantly, uncontrollably dripping with sweat. For millions of people out there, this isn't some nightmare scenario. It's just their daily reality. We're going to be talking about hyperhidrosis, which is a medical condition that goes way beyond just normal sweating. So here's our game plan. We're going to break down what this condition actually is, figure out where it comes from, look at how doctors diagnose it, and most importantly, explore all the things that can be done about it, from simple treatments all the way to surgery. All right, let's dive right in. First things first, what exactly is hyperhidrosis, and why is it so much more than just a minor annoyance? I mean, we've all been there, right? You're nervous before a big presentation, or it's a super hot day, but just imagine that feeling cranked up to 11, happening for no reason at all, and it starts affecting literally everything you do. Okay, so here's the official medical definition, and, the word that just leaps off the page is disabling. This isn't your body doing its job of cooling you down. Nope. This is the system going haywire. It's a condition that can actually dictate your career, mess up your social life, and just fundamentally change how you interact with the world. That's a heavy, heavy burden. So, what in the world is going on inside the body to make this happen? Well, it turns out it's not one single story. There are actually two very different reasons this can occur. Think of it like this. On one hand, you've got primary hyperhidrosis. This is the most common kind, and it's like your body's thermostat for sweating is just stuck in the on position. We don't really know why, but it seems to be genetic. Then you have secondary hyperhidrosis, which is more like a warning light on your dashboard. The sweating is a symptom, a sign that something else is going on in your body that needs a closer look. Figuring out which path you're on is absolutely the first step. And for that faulty thermostat type, well, a lot of the time, it's in your genes. For people with excessive hand sweating, a full 50% of them have a family member with the exact same issue. It's often passed down directly, which means if one parent has it, their kid has a 50-50 shot of having it too. It's a literal flip of a coin. And this case study right here is just heartbreaking because it puts a human face on it. This isn't just about having wet hands. This is about a teenager who's avoiding his friends, avoiding parties, avoiding life, all because of a condition he has absolutely no control over. It's a huge social barrier that can start really, really early. But here's the good news. You don't have to just live with it in silence. There is a clear path to getting answers and, more importantly, finding solutions that can actually work. And hey, if you're worried about going through a whole battery of intimidating, complicated tests, you can probably take a breath. For most people with that common, localized kind, a straightforward, honest chat with your doctor and a physical exam is usually all it takes to get an accurate diagnosis. But for the more complex cases, doctors do have some pretty cool tools. The Storch iodine test is kind of like creating a weather map for your sweat. It uses a chemical reaction to paint this literal purple picture of exactly where the sweating is happening. And then there's Gravitry, which is like a tiny rain gauge, precisely measuring just how much you're sweating in milligrams per minute. So what are doctors looking for? Well, there's a really clear pattern. We're talking dripping sweat on the hands and feet that started way back in childhood or around puberty. And here's a weird but super important clue. For a lot of people, something as simple as putting on hand lotion makes the sweating go crazy. It's the total opposite of what you'd expect, and it's a huge telltale sign for doctors. Okay, now for the part I'm sure you've been waiting for, the solutions. What can we actually do to manage or even stop this? The whole approach here is kind of like climbing a ladder. You always start on the lowest, safest rung first. Try the simplest options. You only climb higher to the more invasive treatments if those lower steps just aren't getting the job done. This ladder for underarm sweating shows that journey perfectly. You start with things like strong prescription-level antiperspirants. If that's not enough, the next step up might be something like botulinum toxin A injections, which can temporarily block the nerve signals to those sweat glands. It's only after those options don't work that surgical options even enter the conversation. Now, for sweaty hands, the story's a little different. Topical creams, they often just don't work that well on the thick skin of your palms. There's a treatment called Hyperhidrosis, which uses a gentle electrical current and water that can be a real game changer for some. But as you can see from this chart, for those with the most severe, life-altering cases, surgery is often the only thing that provides that complete, lasting relief. So, let's talk about the big one, surgery.
And I know it sounds intense, but for some people, it is no exaggeration to say this is a life-changing procedure. Let's break down how it works.
Okay, that name is a mouthful, I know. Endoscopic, thoracoscopic sympathectomy. But the idea behind it is actually brilliantly simple. Think of the nerves that control sweating as a telephone line that's just stuck, constantly sending a sweat now signal. During ETS surgery, a surgeon basically goes in through a tiny little keyhole incision and very carefully cuts that specific wire that's sending the faulty signal to your hands. And the results are, well, they're astonishing. For severe hand sweating, the success rate is over 95%. The sweating just stops, instantly, permanently. For people who have spent their entire lives hiding their hands, this can feel like an absolute miracle. But, and this is a huge but, there is a catch. And this is it. This is the trade-off. It's called compensatory sweating, and it is the single most important thing to understand before ever considering this surgery. This brings us to the reality of what life is like after treatment, because it's not always a perfect fairy tale ending, and understanding the potential downsides is every bit as important as knowing about the benefits. So what is it? Okay, imagine you finally fix a leaky faucet in your bathroom, only to find out all that water is now flooding your kitchen instead. That, in a nutshell, is compensatory sweating. Your body can't sweat from your hands anymore, so it finds new places to release that sweat, usually on your back, your chest, or your legs. For most people, it's a manageable nuisance. But for a small number of people, the new problem can actually be worse than the one they started with. And this is why it is so incredibly critical for doctors to select the right patients for this procedure. For severe hand sweating, ETS is a home run. It just works. But for other parts of the body, it's more of a gamble. The data shows that for feet, the improvement often feeds over time. And for underarm or facial sweating, patient satisfaction is much lower, mostly because of that big trade-off with compensatory sweating. And really, this is the question that every single patient has to answer for themselves. It's a deeply personal decision, right? Weighing the daily, certain misery of the condition you have against the potential risks of a cure. But the good news is, thanks to decades of medical progress, it's a decision people can make with their eyes wide open, armed with knowledge and with hope. If you're struggling with this, please know you are not alone, and there really are paths to a drier, more confident life.